doctor's bag is a bit of a fading memory, but decades ago, when many family doctors still made house calls, it was a familiar sight, a place to carry a blood pressure cuff, maybe a thermometer and a stethoscope. Well, now a startup based right here in our region has set out to reinvent the doctor's bag and put an entire clinic inside. And of course, it connects to the cloud. The new product's called Clinic in the Bag, and the company's called Rijuven. Evans Augustine is the company's CEO, and welcome. Good to have you here.
Thank you. I'm glad to be here.
Yeah, and this is it, right? A whole clinic in a bag.
A whole clinic in a bag. It's basically anyone who has this bag is a walking clinic.
It's got almost all the tools in it that you would find if you went to the emergency room, right? Except pretty much except for the x-ray.
That is correct. So it has tools to take all your vitals, tools to screen for your heart.
We've got to open it up. Let's look at it while you're talking about it and let people see it. And then we can talk about why and what you think the opportunity is here. So this is what a healthcare provider, not necessarily the doctor, right? This could be a nurse, this could be an EMT, a medical technician, might take this directly to the patient though, right?
So these tools are set up so that anyone practically can actually administer the physical exam wherever it may be, at the patient's home, at the patient's workplace, in a kiosk, at an airport, and then have a doctor come in where the doctor is provided with actionable information so that they can make diagnostic decision and disease discovery.
Well, and so what's in the bag?
So we have a blood pressure cuff, we have a tool to do complete heart screening, tools to screen for the lung, a thermometer, we have a continuous monitoring of your heart rhythm, we have an iPad, of course. Okay. We have a weight scale, and we have tools to actually do labs and also an ultrasound.
So you could do a urinalysis or something?
So you could do urinalysis
on site?
On site, and with a finger prick, you can get your complete lipid panel, you can get your total cholesterol, the good cholesterol, the bad cholesterol, triglyceride, etc.
So unlike my old Dr. Forrest back in Dover, Delaware, with his leather bag, where he might have the stethoscope or the whatever, these then all connect electronically through the iPad to the cloud?
That's correct. So we're using the ubiquity and the ease of use of mobile technology to interface with all these tools and then have the doctor the information that he or she may need to discover any diseases or any diagnostic decision that the doctor has to be made so that you can be on your way to get well. And that may be prescribing you with the appropriate medicine so that you could alleviate the issue that you may have, or even further refer you to a specialist.
And so the nurse or whatever can be with the patient. The doctor then could be pretty much anywhere in the world.
Exactly, Bill. So the doctor could be in another city. The doctor could be in another continent. So, for example, we did a validation in India. So we had a medical professional in the field in rural India, and we had a doctor right here in Pittsburgh who was able to diagnose a very dangerous heart abnormality and essentially saving that person's life from Pittsburgh while the person was being examined in India.
Well, you hear about this thing, telemedicine, but it always seems like it's really fancy specialties, right? You got to get to that one neurosurgeon somewhere, but they're usually working with another hospital who can do all the initial screening and labs. This sort of really closes the gap and brings it all the way down to the family medicine level.
That is correct. So when we started this, we had a group of doctors and wanted to know, using today's technology, looking at the gap that exists currently actually between people in need of care, where you look at, for example, in the United States, half of all adults have at least one chronic condition.
Wow.
Right? And that problem is even more pronounced in emerging markets, where you have upwards of 75% of populations that don't have access to the most basic healthcare needs. So those tools were based on what doctors told us that they need to make at least 80% of the time a proper diagnostic decision. And be, at the same time, be able to do that in a way where they don't need to be with the patient. Okay, so again, we were able to close the gap between people in need of health care and those people providing healthcare.
So the company's been around for a few years now. You're only getting to the point now that you're sort of rolling this out worldwide as a real product?
That's correct. So we've been pretty busy, Bill. We spent the last few years, talking to doctors, validating the solution. We also spent the last year specifically providing these tools to medical professionals so that we can validate the logistics and what it would take for these medical professionals to actually administer physical exams. So now we're ready to roll out the complete reinvention of primary care, where again we set out to democratize how primary care is being administered, where it doesn't depend on currently. It's based on where you are. If you're in an urban area, you may have care. With this tool, it totally neutralizes the lack of medical professional and those in need of care.
Well, and then you think about the issue of primary care physicians aging out. They're a big problem across the country. So even some of those urban areas, it's not all that easy to find the primary care physician anymore.
That is correct. So there is a certain level of convenience, and also it's fairly inexpensive. So we created these tools with the emerging markets in mind. So that allowed us to make some early decisions in terms of the technology that we use and some of the tools that we're able to incorporate into this to make it cost effective.
Really exciting. If people want to find out more about the company Rijuven and the product Clinic in a Bag, how do they find you?
Clinic in a Bag, clinictodoor.com and rijuven.com.
Clinictodoor.com. Evans Augustine, really cool. Congratulations.
Thank you,
Go
Bill.
Out there and save the world.
Yep.
Love
Thank
it.
you very much. Appreciate it.
Well, so now that we've brought back the doctor's bag and the house call, how about same-day doctor's appointments? Allegheny Health Network has done just that, and in just a few moments, we'll find out why. We're heading back to the future of healthcare after this short break. Stay with us.